1.
Hello, my name's Jacob. Today I'm going to be doing my wound culture video. I'm going to be using my GPSP. First I would knock on the door, would enter the room, shut the door, provide privacy, identify my patient. Using 2 patient identifiers, I would check the bracelet, make sure that they match. I would identify myself to the patient. Hello, my name is Jacob. I'm going to be your nurse today. I'm going to be doing a wound culture on you. Is that okay? I would assess their pain level. At this time that they're reporting a 0 out of 10 pain level. If they reported any pain, I would use my 11 rights and 3 checks to administer pain medicine that the doctor prescribed. I would also check to see if they had any allergies. Okay, at this point, since they didn't have any pain, I wouldn't administer any pain medicine. So at this point, I would go ahead and perform hand hygiene. And put on gloves. To remove the dressing, I would use the push-pull method to remove the tape. If the dressing was stuck to the wound, I would apply sterile dressing or sterile saline to loosen the dressing, and I would remove it. When I removed it, I would assess the dressing for type, amount, color, and odor of the discharge before discarding. At that point, I would discard the dressing and change my gloves, perform hand hygiene, put on new gloves. I would get my normal saline, or my sterile saline. And with the trash can, I would do a swishing motion to sterilize the brim of the bottle before pouring it into my canister with my 404s. At this point, I would pick up my 404 to clean down the center of the wound. At this point, I would dispose of that one, picking up another one, going to the furthest away side, discarding of that one, or picking up another one, and cleaning the one closest to me, discarding of that one. Then I would pick up a dry one, patting it dry down the middle, discarding of that one, picking up a new dry one to pat dry the furthest side away from me, discarding of that one, picking up a new dry one to pat dry the one closest to me, and discarding of that. At that point, I would change my gloves, perform hand hygiene, put new gloves on. I'll do my culture. So remove my tube from the packaging, making sure to not touch the outside of the tubing. I would get it down inside of the wound, making sure to apply constant pressure to get a good sample, making sure not to touch any outside skin, intact skin, or necrotic tissue to contaminate the swab. I would then put it back in the tube, making sure not to touch the outside to contaminate the sample. I would then label the tube according to my facility's policies with the patient's name, date of birth, location of the wound, type of wound, my name, and date and initials. I would then put it back in the packaging and transport it according to my facility's policies. I would then remove my gloves, make sure that my patient had everything that they needed, make sure that they were comfortable, make sure that their clot was in reach, perform hand hygiene, and report the report.